Good afternoon. My name is Stephanie Marchand. This presentation is on community mobilization, the Santa Ana Health Crusade. Community mobilization is defined as a capacity building process through which community individuals, groups, or organizations plan, carry out, and evaluate activities on a participatory and sustained basis to improve their health and other needs, either on their own initiative or stimulated by others. The Santa Ana Health Crusade is about a Latino community in Orange County, Santa Ana, California, whose mission is to build better lives for themselves and their kids. After noticing a high rate of obesity and diabetes, the community came together to spread awareness of these diseases. In doing so, another issue arose: the lack of recreational areas for children. In that, many members joined forces to create a community center where children and adults can participate in physical activity and achieve a healthy lifestyle. I have broken down Santa Ana's population based on age, gender, and ethnicity, just so we have a good idea of the people living in the community. Santa Ana's population stands at 334,227. Over 70% of Santa Ana is Latino. The average family of four earns just above poverty level wages. 4 years ago, in a national survey of the toughest cities to live in, a survey that weighed levels of crime, poverty, and disease, Santa Ana ranked number 1. The community needs are the gaps between what a situation is and what it should be. We need to find out what the community is lacking, its need, and how the community members are affected by it. Let's start with the community needs map, which gives us a breakdown of where the city of Santa Ana, California is lacking. Poverty. Santa Ana's percentage of residents living in poverty in 2012 came out to 21.5%. This city has more residents living per household, which is above state average, and with the number of rooms per household being below state average. Education. This city is number 7 on the list of top 100 least educated cities. Income. The average family of 4 earns just above poverty level wages. Water contamination. Testing of random drinking water stations in Santa Ana reported high levels of copper, lead, and chlorine. Unemployment. Santa Ana stands at 8.4% unemployment rate based on statistics done in June of 2014. Diabetes. Rates of diabetes increased from 6.6% to 7.7% between 2003 and 2009. 7.4% of adults reported having diabetes in 2011 through 2012. Obesity. A 2010 survey by Public Health Advocacy showed Santa Ana as having 46.5% of the population as overweight or obese. Air pollution. The air quality index level of Santa Ana came out to 141 in 2012. The United States average is an air quality index level of 74. This is more than double the U.S. average. Lack of recreational areas. In order to get proper exercise, an area where children and adults can be able to conduct any form of physical activity is needed. Santa Ana's residents have reported that there is a major lack of recreational areas, and signs are posted all around the parts of town where there is enough room for their children to play that there is no running, skating, bicycling, and basically no form of recreation allowed. I chose these particular areas for the community needs map because they can all be related back to health, and I felt they stood out from the rest of the issues. Community assets are those things that can be used to improve quality of life. We need to find out what resources the community has available that we can use to help us satisfy the needs of the community. Many resources are available in the great town of Santa Ana. The Latino Health Access was founded by public health doctor America Bracho. Her mission was to make the people of Santa Ana lead healthier lives for themselves and their children. Health clinics offer information and supplies for obesity and diabetes programs. The promoters of Santa Ana are the community members themselves. They go door to door spreading the word on healthier living and speak through experience and the knowledge they gained while being treated. Schools are used to teach the students and their parents about healthy eating and exercise. The community organizers are the ones setting everything up for the community. They recruit, they teach, and they spread their word. Vacant lots in Santa Ana are plenty because of the city's redevelopment plan that has never come into play. These lots can serve much promise to the community. Religious institutions play a part when trying to organize and collect funding for projects in Santa Ana. Since this city is mostly Latino and majority of Latinos are Catholic, they share a bond with their churches. Libraries provide Santa Ana with much knowledge and resources, and with all the efforts they are doing, they need as much help as they can get. Local and outside funding is important. Many of the residents live close to poverty level. There is not enough money that they can all gather up based on their salaries alone. This is why the community organizers and promoters are so important. They can go around promoting their idea in hopes of finding donations from wealthy companies that will appreciate their efforts in making their community a healthier place. The community's push for having a recreational park comes from seeing overweight children and adults with diabetes, with no real way to get proper physical activity. Irma Rivera was a lead promoter in getting others to help push for a recreational park for the kids. The community assets that are shown here all serve a major purpose in this community's redevelopment plan. A diabetes program began where people from the community took the roles as the promoters. These promoters went around house to house spreading awareness of diabetes, proper health, nutrition, and exercise. In a place where diabetes and obesity is high, there is a small number of recreational areas where people, especially kids, can run around and play. In a place that lacks so much space for kids to run around and play, it turns out dangerous and leads to problems, health problems from the lack of physical activity. Our mission is to have Santa Ana community mobilize and push for healthier practices. The mission is to open everyone's eyes in the community of Santa Ana. Healthy eating and physical activity matter. With the help of everyone, we can change the city from being crime, poverty, and disease-ran to one of the healthiest cities in America. Santa Ana is a small place that, with the help of many community members, can change statistical data and bring the negative demographics to a neutral or even better average than the United States as a whole. The vision statement is vital. With the help of all community members within Santa Ana, we can change the way we are looked at and treated. Our negative demographics can and will change for the better. The strengths and challenges the community of Santa Ana face are far too many to name all, but here I show you a few important ones. Challenges. In the city of Santa Ana, low income, language, environmental factors affects what this community is trying to achieve. When it comes to money, this city does not have a lot of it. Much emphasis is put on outside sources for funding and donations to help the community achieve their goal. Being over 70% Latino, the members of the community suffer a language barrier that will put them in difficult situations later on. Pollution and contamination make it tough for the city to achieve its healthy outlook. The more and more awareness is taught, the easier it will be to fix these types of issues. Strengths. The community members are highly proactive, meaning they volunteer and go out to accomplish their mission or goals. The amount of notice this group has received for the obstacles they've accomplished when other community clinics call up Santa Ana and ask how they managed to achieve their desired results and what they are doing to do the same. That is when you know you're getting somewhere. Recruiting people from within the community to teach and spread awareness. If a person is speaking about diabetes from experience because they overcame their disease or learned how to manage it, more people will pay attention to him or her because they see a living, breathing person that is going through or went through what they are currently dealing with. To put it simply, these people are committed and have major determination. When it comes to Santa Ana's health crusade, the issue as having a high number of diabetes and obesity rates and low number of recreational areas was recognized. And the individuals within the community are the ones who recognize the issue at hand. Organizing the community was done by the Latino Health Access Organization, where the patients themselves volunteered to spread awareness of the issues. An evaluation of the community, determining the priority and setting goals was established. By choosing a location to build their community center, taking the proper steps to make the vacant lot theirs, and setting up the plans to build, they succeeded in changing their community for the better. As of right now, the plan is in process, so no intervention strategies, implementation, evaluation of outcomes, or maintenance was conducted. Conclusion. By having a community center in the city of Santa Ana, the health issues that could most effectively be addressed are physical activity rates. The needs and assets maps give an overview on what the community is lacking and the resources they have available to achieve their goals. The community has come a long way from where they began. Pushing to get their community center was a huge challenge for them, one that took 7 years. Now, the small town of Santa Ana has gotten noticed. And I, as a representative from the health department, can help the community achieve more goals and make their town one of the healthiest towns in America.